This is The Naked Patient, Beyond the Operating Room. Listen as Dr. Nicholas Howland talks with real patients about their real experiences with plastic surgery.
Welcome to the Naked Patient Podcast. I'm Dr. Nicholas Howland. I'm going to do this at the start of every episode. I'm just going to remind all the listeners out there and viewers, because we've got cameras in here, that all of the patients that are on the show have signed a HIPAA waiver, so they're here and have given consent to talk about their procedures that they've had done. In certain cases, we will have patients who wish to remain somewhat anonymous, and so we will change their names under those certain cases. Today we've got Haley DeBruin here. Haley, I'm really excited for. She was one of my very, very first patients when I first came into practice in Draper, Utah about 5 years ago. So Haley, let's start with you. I just want you to tell everybody hello and tell me what brought you to me in the first place.
I came to Dr. Howland. I came to you for a breast augmentation. That was the first procedure that I had done. When I was looking in Salt Lake, I probably went to 4 or 5 different offices, different surgeons. And kind of what I told you when you just had your anniversary party was the one reason that really drew me to you as a surgeon was not only your body of work, but also that being in Salt Lake, you were one of the only surgeons that proudly said that you would work with trans patients for top surgery and whatever it was that they were looking for, and to put that out there in a area like Salt Lake or in Draper even, that's pretty conservative and kind of either tries to tuck that under the rug, or there's a lot of surgeons that just go, no, it's not in my beliefs, it's not part of what I will do. Spoke a lot about how I felt you would be as a surgeon for everyone.
Yeah, I remember you telling me that the first time you told me that, and it kind of took me off guard. I'll tell you my story. I want to know why that was so important. Mm-hmm. You kind of touched on it there a little bit, but I'll tell you a story about how that came about with me. Mm-hmm. When I first came to Draper, all plastic surgeons are trained a little bit in transgender operations, and one of my very first patients that came to me was a male to female trans patient who had a breast augmentation done in Thailand, and it was just terrible results. Her implants were completely bottomed out. They were sitting on her stomach. And she asked if I could fix it. And I'm just, well, yeah, absolutely. And this woman just starts sobbing. And I said, what's wrong? And she says, I have been to 6 surgeons throughout the state. 3 surgeons have looked at me in the eye and said, I don't operate on your kind. And 3 have said, that's against my religion. And almost overnight, trans surgery became a huge part of my practice, almost unwittingly, just because it's such a word of mouth community. And that needs to probably be a whole other episode. But that was how I first jumped into even doing trans surgery. It wasn't going to be part of my practice purposefully. I have no problem with it, but it just was unintentional. Mm-hmm. So I'm curious just why that was such a motivating factor for you to choose me as your surgeon.
It really came down to the human aspect of it. My brother is gay. I have a lot of friends who are part of the LGBTQA community. It just spoke to me that you were someone who really cared about the person and didn't really take any stock into, what their politics, what their religion, what their background, what their history, what their orientation was. You were just there to be someone who was there to help them in any way, shape, or form. And it spoke also to how you've, from the get-go have talked about surgery being an empowerment piece. And for someone who is transitioning, you can't have one and not the other. Yeah. If you're a surgeon, you can't speak to empowerment of someone and then disregard or cut away from a group of people and say that I'm not going to serve you.
Yeah, no, you have to be authentic, and I certainly don't fault any surgeon who feels like it's against their moral code to do those sorts of operations. But for me, it wasn't.
Yeah.
Okay, so let's get back to you.
Okay.
That was a small little tangent, but an interesting one. So you came in for a breast augmentation. What pushed that? I mean, I think every woman has a different reason for breast augmentation, which is funny because you would think small, want them bigger.
Yeah.
So, but I think every woman has some sort of different motivation. So I want to dive into a little bit of what your motivation was.
I had wanted one for quite a while. I felt like with my body shape and what I was not blessed with, that something just felt out of proportion. I also think that there was room to grow because when I came in, I had a lot of excess tissue and a lot of skin. So it seemed like genetics had set me up to have bigger boobs and then just didn't follow through from sports or whatever it had been that was kind of, that changed that from happening.
Do the women in your family have large breasts?
Yeah. They were all, my mom has large breasts. My grandmother did. On my dad's side of the family, they all do. And the boob fairy just didn't come to see me. So we just, I felt like I had just these loose tube socks.
She skips a lot of people, that boob fairy.
I know. She just, much to our chagrin.
Yeah, not enough money in your bra.
Yeah.
You're supposed to leave it.
I was supposed to leave coins in my bras, and it didn't happen, I guess. I wasn't told that part. So after I got a divorce, I was like, you know what? It's time for me to do something that I've wanted to do for a while. And I just kind of finally had the opportunity and the time and the funds to do it.
How soon after your divorce was your breast augmentation?
I officially moved out and separated in April, and then I think September, end of September, you happened to have a Friday opening, and I just squeezed right in and took it, or else it was going to be a 3 or 4 month wait.
Okay, so it was pretty soon. You said it, so I'm gonna dive into it a little bit. How much of the divorce played a role in I want this surgery?
To be honest, it was a big self-confidence thing when you're going back out in the dating world and stuff like that, and you've been with someone for 13 years who said, oh no, you're fine, everything's fine, you look great. But then when you're out dating new people, you start to think, well, what do I look like versus what do the other people that they're used to seeing look like, or people who are my age? And it psychs you out. And there's that body positivity or body neutrality thing where you should just accept how you are. But also, I wanted to be comfortable in my own skin as well, regardless of what the judgment to have surgery or not to have surgery would have been.
Yeah. So this is very different than a revenge bod post-breakup.
Yeah, no.
Post-divorce.
Yeah, it was more just wanting to be comfortable in my own skin and accept myself for what I wanted to have myself look like.
Yeah. So this is 1,000% for you.
Yeah.
I love that.
Yeah, it had nothing to do with anyone else.
Yeah. That's one of the things that I preach, I think, probably more than I should. It's a major tenet of my belief in plastic surgery is that plastic surgery is very empowering. We've said it before, but it's got to be for the right reason. It's got to be for you. And if you had come in and said, I just got divorced. He always wanted me to have larger breasts, and I'm going to do this to stick it to him. We
Stick it to the man.
Yeah, we might have had a conversation of hey, maybe not the right time yet. But okay, so this was completely for you, which I love that. Were you dating anybody at the time?
yes, we were kind of mid not being together. Like I had started dating someone. We kind of had broken up beginning of August. And so in my healing and everything, I was not with anyone. And then when we got back together, he's like, oh, it's my 6-month signing bonus. I was like, I don't know, but sure, I guess. So it was just, it was kind of a strange transition phase there as well.
Yeah. I still like though that this was really just you. There wasn't anybody that had pushed you away and then driven this. There wasn't anybody that was there and pushing or driving this. This was still just you. Yeah. And I remember, I think I only ever met with you in consultation beforehand and during and everything. I want to get into a little bit of nuts and bolts of the surgery. So tell me a little bit how you prepared to come in. Well, let's talk about the consultation.
Okay.
So tell me how you prepared to come into the consultation, and tell me what your own thoughts were leaving the consultation. Because you said you saw 5 or 6 other people beforehand.
Yeah.
So I love that preparation. I actually like people to see multiple consultations, because whoever you choose as a surgeon, you should really, that should be your guy or girl.
Yeah.
Like, you should really vibe with that person. But I want to hear from you.
My initial search for who I was going to go see, a lot of it had to do with Instagram. That was a big proponent of who I was going to look at, because if they didn't have something that I could look at beforehand, I didn't really want to waste my time, because, it's old school. If it's old school book and, photos, that could be 30 to 45 minutes of drive time or whatever, plus the consultation that I wanted to cut out, cut the fat initially. Some of them were from referrals from people who I knew who had already had a breast augmentation. Some of them were just from searching on Google. So that's kind of how I prepared who I was going to go see. From there, it they kind of eliminated themselves, either because of cost. Some, my very first consultation for a lift and a breast augmentation was going to be $12,000.
Okay.
And I was like, that doesn't seem, for our area, that just doesn't seem right. That seems really high.
4 years ago.
Yeah, especially, and 4 years ago.
Now it's pretty common.
Yeah. But 4 years ago, 5 to 6, 7 was about average. If it had been less than that, I would have been a little bit skeptical as well. So,
Sure.
And then, one guy was still doing over the muscle. Some were telling me I absolutely had to have a lift, no questions asked, and that I had to have these certain types of implants, that they had to be the gummy bear, they had to be this, had to be that. And then when I came and spoke with you last, you kind of left a few things up to me. And there were also a couple of things that you said that made me think, okay, this guy is not only looking out for the patient, but also, for his own reputation, and won't do something that is going to end up looking ridiculous or is going to be detrimental in the future. So the first thing was that you told me, a lift would probably be helpful, but it's totally up to you, which no one else had left it up to me. They were like, no, you need to have this done.
You were very borderline.
Yeah.
And what some people, so what I tell patients, implants are going to give you a very, very subtle lift, not much. And so there are a lot of patients that I do tell, just like those others, you need a lift. And there are some patients who I say, you're right on the border. We can do the implants and then see how it looks. And I leave it up to them. And I think that's right where you were.
Yeah, that's exactly what you said. So the lift, the other thing that you said was that you would not go too big for my body shape. That you said, you're a walking billboard, basically. I don't want you to look like a square. You should still have, the good proportions. And I had never had the intention of going massive anyway. So that was neither here nor there. But the fact that you said that to me prior and set that expectation and kind of set that boundary was really important too, just because it showed how you as a doctor had, your code and your compass that you went by.
Yeah, it can be hard, especially as a young plastic surgeon. It can be hard looking at money that's potentially coming in and saying no to somebody. I'm not going to do this procedure. I'll tell you, this is I think I was still perfecting the billboard speech with you, but I do give a lot of patients this same speech where they ask me to do something. And if I feel like it's completely ridiculous, I give them my speech, which is, I want you to be happy. That's my number one goal. But my number two goal is that you become my walking billboard. And sweetie, I don't make bad billboards. Which is ironic because I sometimes do put up bad billboards. But that is a tongue-in-cheek, hugely important factor for me in plastic surgery. There are, there are people that want to do things that I don't think it's definitely for them. But if I feel like it's going to be actually disfiguring, then I tell people there's 8 other plastic surgeons in my building.
Yeah. And
I'm sure you can find somebody who's willing to take that money, but there are certain things that I'm just not going to do.
Yeah.
Okay, so left the consultation and said, this is it.
Yep. Spoke with your front desk, had them put me on a surgery date that was a little bit further out. I think it was like end of November, beginning of December. And then like a week later, they called and they're like, hey, we've got a cancellation for the end of this week. Do you want it? So my preparation to go into surgery was really shortened. Like I don't want to say that I was not prepared, but it didn't give me time to maybe think about it and start to overthink what I was doing. And I'm not necessarily too much of an overthinker when I make a decision, like I'm in it.
Yeah.
But they called me and they said, hey, like come down this week, like put your deposit down. We'll get you on the books. We'll make sure we like lock that in. And that Friday I was in and having the surgery done and, stayed with my parents for the week and just kind of healed up for a little bit.
Yeah. Tell me your recovery process. Tell me, what were your expectations for what the surgery itself and the pain was going to be like, and then what was the actual, and did those two match?
I think, I'm trying to remember. I think my expectation for the pain was pretty spot on. Like it wasn't terrible, but I definitely pushed myself too hard too fast.
What do you mean?
I went back to work way too early.
Okay.
I was like, surgery Friday, Saturday, Sunday, Monday, maybe Tuesday I'll take off. And I was back to doing hair, like I think Wednesday or
of course you are.
Thursday, of course. And
now I get told.
nothing went wrong. It was more, I think I still had a little bit of pain, and the pain meds, I think, were just the worst part of it.
Yeah.
But, everything else was pretty easy, pretty feasible. I mean, came home and my boobs were up to my chin. And
so explain that to people, because they're going to need to understand that.
So at first, and you had told me this too, that after an augmentation, your breasts have to settle. It takes about 6 months for them to finally settle into where they're going to be and where they're going to sit naturally. So the first little while, they're going to just be these mountains of swelling and of, everything else just clear up in the top of your pectoral, basically.
Yeah, they kind of look like torpedoes. They just hit really high.
Yeah, I mean, they really were like all the way up, almost to my armpit line. Like they were up there. And then once the swelling and everything kind of settles down and minimizes, then everything kind of settles down into the pocket where it's going to rest.
Yeah.
So, and like you said, that took about 6 months. And
what I tell people is no happy or sad for 2 weeks about how big they are. They're going to be swollen. That's going to change, and then no happy or sad for 6 months about where they sit, because they're going to sit high and then they're going to settle into position. Most patients it settles before 6 months, but 6 months is the earliest you would actually go in if you needed to fix it, if they weren't settling for some reason. When did you feel back to normal?
I think once I could start lifting more than 10 pounds again, because that's one of the stipulations after surgery is you can't lift more than 10 pounds for, what is it?
2 weeks.
2 weeks? Okay.
If you took 3, great.
I think I might have, but so I was also working part-time at a tattoo shop at the time.
Nice.
And so I had to make them carry in all the water jugs and stuff like that. It was this poor, pitiful me act for a little while, which doesn't actually sit very well with me. I was like, God, I just want to, just let me do it. Like, no, you and your girls have to take it easy.
So did were there any regrets?
I do think I would have liked to do a lift after the fact. But then it's been, 4 years almost. It'll be almost 5. And it's at the point kind of now where I'm like, well.
What made you avoid the lift in the first place?
The scarring.
Okay.
The potential of what the scarring could have been.
So with a lift, we have to cut around the areola. And so there's always at least a scar around the areola, and then oftentimes an up and down scar along with the horizontal scar. So it definitely is more scarring.
And I didn't know how I was going to scar. I had potentially with other surgeries, I've gone from really good, very little scarring to really obvious. So I just wasn't sure how that area would heal and how it would end up looking. And the other part, I think, was like I didn't realize how involved a lift was surgically. Yeah. So I think that kind of scared me away a little bit. Yeah. The other thing, honestly, I might have gone a little bit smaller.
Really? Simply
because I have a hard time finding bras that fit, especially sports bras. I'm like right in the middle of being a large. I can fit into a large, but it kind of compresses and starts to hurt after a little while. And then like an extra large is way too loose around my rib cage. So, and shirt, just the fit of certain things, shirts and stuff. I always have to kind of size up and then get them altered.
Yeah.
So that's maybe the only thing that I would say is the one thing that I maybe would have done differently.
Yeah. I love this podcast because when I first had the idea for this, it was all about letting patients come on and tell their stories. But I'm realizing more and more, and the more that we do, that this is just going to be me ideas to be a better surgeon. Like this podcast. So it's very selfish reasons, right? But this podcast is going to make me such a better person and surgeon. And so we're going to keep doing it.
Yeah.
Okay. So we want to get to this. You had a second surgery.
I did.
And so we talked mostly about the breast augmentation, which, I guess maybe we'll have to talk about the lift at some point here. Yeah. But tell us about the second surgery that you had done.
I had a septoplasty.
Yay.
And
tell people what that is.
It was amazing. I broke my nose when I was 6 or 7, pushing my dog out of the way of a glider and just smashed my nose. And my septum, I had a deviated septum. Which, a lot of people probably do. And I could not breathe out of my right nostril for basically my entire life. I would, especially when I was sleeping, I would roll over, or I would be laying on my back, and my whole entire just right side would just clog up. So being sick, allergy season, playing soccer, sports, singing, all were impacted
And
by this.
singing's pretty important too.
It is. Yep. I'm the lead singer in a band called Blood Moon Majesty, which we're a rock band. And so the septum and the boobs are both investments in that because being the front person, I guess. So
You're the lead singer, right?
I am. Yep. I'm the lead singer.
Okay. And you had, how long had you been in this band before you had the nose done?
I had been in the band for 2 years. And so I had the septum done in August, like right pandemic. So it was 2 years ago, 2020, August. And we weren't really practicing much, but we came back and started writing some new music pretty close after I had been kind of released and gotten all this lovely stuff out of my nose, which I'm sure we'll talk about too.
Were they like, hey, you sound really nasally. We need you to get this fixed?
They're like, I think there's something wrong with your voice. Could you please? No, it was never anything that anyone noticed. But as soon as I came back, I noticed it. The band members all noticed it. It was more, one, breathing makes a huge difference in your singing. But there was a quality in my voice that all of a sudden there was more resonance up through my nasal cavity, which helped a ton.
Yeah, the airflow it completely changes. I'm a terrible singer, so I couldn't explain it. But so you came in for this. Did you see 5 other surgeons beforehand?
I did not, no.
Okay.
I knew you, I knew what you were about, and I called my insurance and asked who was on my list, and they said, well, Dr. Howland is there. I was like, done, sold. Called you up and.
Well, I certainly appreciate that. With a septoplasty, I'll just describe it a little bit so people understand. You can do a septoplasty one of 2 ways. You can do it either, and really any nose job or rhinoplasty, you can do it in 2 ways. You do it open or you can do it closed. You have to make an incision either way. So the open versus closed sounds a little bit different, but there's incisions on both of them. However, with the open, there's an incision that goes across the columella, this little bridge of skin that separates the 2 sides of the nose. And then there's an incision inside the nostril. With the closed, you don't have that incision across the columella. And I like to do an open because that's the way I was trained. It also gives you a little bit more exposure of the anatomy underneath. And so you have a little bit more control and you can tell a little bit easier exactly what you're doing. But with a septoplasty, we're really not changing the structure of the nose at all. We're removing a square piece of cartilage that separates the 2 sides of the nose, and that's part of the septum. And usually that with a deviated septum, that cartilage has been broken and it's now scarred, or it's kinked, or there's bony growth. There's a number of reasons that can be causing that kind of pinched off area of the nose. So we take that out, opens up the airways, and done. You can breathe better. And it doesn't, but we didn't change the structure of your nose at all.
No.
We probably had a conversation about, do you want anything different? Do you want your tip done or your dorsum done or anything like that?
We did. Because I do have a little bit of a bump. And you did ask me if I wanted that changed. And it was something to me that wasn't super important for me to alter. And also it kind of was a sticking point for me that I wasn't going and changing my facial structure at all. It was 100% about me breathing. So it wasn't a vanity piece, or if you even want to call it that. It had nothing to do with what I looked like. It was 100% about being comfortable and being able to breathe.
Love it. And I'm going to go back and say there's no vanity in plastic surgery.
There's no, yeah.
at least from my standpoint and my perspective. Yeah. So I do have a funny story about that. I think I might have told you this story, but I used to have a guy. His name is Enzo Pagini, who worked for me on some of my social media, and he's excellent.
Yeah.
I would refer him to anybody. Enzo's awesome. One of his jobs was to curate before and after photographs of patients of mine, and then we would create a post together, and he would put it up. And I remember he sent me a before and after of your face and said, "Hey, here's a nose that we did. Let's put up this before and after." And so again, with a septoplasty, the nose does not change. Your before and after face looks exactly the same.
Yeah.
And I'm kind of like, what difference do you see here? And so that we're going to put up. And God bless him, he says, "Oh, you're right. There's no difference." But I don't know, maybe we should put it up and just say, look, she looks the same. She breathes better.
Yep, exactly. I mean, and it's kind of maybe part along the lines of when you did the posts about, you know, how social media can distort what a before and after looks like by only like positioning your body differently or looking forward a little bit more. You know, it could be something along those lines, because I don't think people realize. I certainly didn't know that was the case, because you have celebrities and other people saying, "Oh, well, yeah, I did have a nose job, but it was only for my septum. I had a deviated septum. That's all we were doing." And you obviously know there's an obvious difference in their appearance afterwards. So I think it's maybe not common knowledge that that's what actually happens, that you are only repairing, you know, cartilage inside.
Yeah. Oh, and I'm gonna share a story that my mom's gonna kill me for sharing, but love you, Mom. She had a deviated septum, and this is one of those like core memories I have as a kid. Okay, and she, to this day, I don't think will tell people I had a nose job. She makes sure everybody knows it was just a deviated septum. But then if you drill down and just like, "Oh, well, I had a little bit of my dorsum shaved," so she did change a little bit of it cosmetically, but for her it was mostly that functional aspect. But she wants to keep any of that cosmetic part out, which again is this like push and pull of trying to change, well, this cosmetic versus functional. And for whatever reason, we associate shame with that cosmetic side of it.
Yeah.
And I remember being in the car with the rest of my siblings, and my dad was taking care of my mom, and she had bandages on her nose. She had black eyes. All of the kids needed food. I mean, they had 6 kids, and that's a lot for my dad to handle in the Suburban. And I remember pulling up to the spaghetti factory, and at the old one in Taylorsville, and my mom did not want to be seen. We were just pulling up to get takeout. My mom did not want to be seen, and so she put a paper bag over her head, which I think was worse.
You maybe wouldn't have even noticed someone sitting in the front seat with their sunglasses on. You would definitely notice someone with a paper bag on their head.
definitely was noticeable, but it's this core memory as a child. And Mom, we're going to get you some therapy around that moment. But that story plays so strongly for me because that's maybe one of the things that's driven this. Like, there's no shame. There should be no shame in plastic surgery. I mean, I just realized that.
Yeah.
Oh, look, it was our own therapy session.
Yeah.
Figuring my own stuff out.
I know, we're both. I mean, and when he had kind of said, there's no vanity, it kind of took me back too, because even though I know that it has, like, I had a boob job and I'm not afraid of like talking about it, but something about being like, oh, well, I only had my nose done because, like, who cares? If you had your nose job done or had your nose done because you have an issue breathing or because you want your nose to look differently, it doesn't matter.
Yeah.
And I think after you kind of corrected that, I thought to myself, oh, yes, we're here because of the whole reason that there shouldn't be shame behind it.
It's for you. And what's funny is everybody has their own ideas of where that cutoff is for themselves of, oh, well, yeah, I can see this as being reasonable, but now all of a sudden it's vanity.
Yeah.
And a lot of people don't have a problem with a woman getting a breast reduction because they can see, well, that's going to change their life. But I've seen a breast augmentation change somebody's life just as much as a breast reduction. So why is the line drawn there?
Yeah.
Or why is the line drawn at your eyelids or your nose or anything else that we suddenly consider, that's cosmetic, you're being vain?
Yeah. Yeah. If it's being done for you, who cares? Like, it doesn't have to be vanity. It doesn't have to be for anyone else. Like, there's no label that needs to be put on it.
Have you experienced any regrets, or have you put any shame on yourself about your plastic surgery?
I don't think I have. I mean, I don't have any regrets about either procedure, as far as would I do them again or not. It's something that I've been 100% happy that I did, and would not have done it otherwise.
How has it changed your life?
I don't. For me, the breast augmentation, like, it hasn't been a marked change of like every day I'm, out there and happy and bouncing around. Like, it's been very subtle, and it's been more so that it just gave me more confidence when I've been out and dating people or meeting people or doing photo shoots, which I was already doing beforehand. So it wasn't like I jumped into this new life after having.
Yeah, I was gonna say I do remember some. So I end up following a lot of my patients on Instagram. Yeah. Instagram's a huge part of my own marketing, and it's also kind of a way to connect with my own patients. And I do remember like a boudoir photo set or photo shoot that you did shortly after.
Yeah.
Talk to me about that.
I think before my augmentation, I was a little bit more ashamed. Like, everything that I was doing was very covered a little bit more. And I think the one that you're talking about specifically was like, I was just out there in pasties and loving it. That has been a big change.
It was beautiful.
Yeah. But yeah, I mean, there's definitely a confidence factor that I never in a million years would have done that pre-augmentation.
Yeah.
So that's definitely been part of it. And the other thing, like I was kind of saying with the band stuff, we always joke, like, I've got friends and stuff that come watch, and they're like, oh yeah, the guys are sitting there trying to zoom in on your boobs and take photos, and I just laugh about it. But if it gets us more people, whatever. But if not, that's fine. It's not, it's not a following aspect as far as with that. But the confidence aspect for sure.
Yeah, that's one of the biggest compliments to me as a surgeon and that's why I start to follow my patients on their social media, because to see them with more confidence, or to see them kind of showing off what they're now proud of. Oh my God, like I get a big smile on my face, my heart's warm, and tear to my eye. And did it.
Checked it off.
Nailed it.
Yep. My mom always jokes when it's a gig or a show. She's like, "Are the girls going to come out and play tonight or not?" Of course. So why not?
I'm going to ask you one last question. It's been an amazing interview. This one is a little bit more subtle. Have you, between the nose and the breasts, I do think that even though I'm trying to bring this, like, there's no cosmetic, there's no functional, everything is helpful. It is helpful to distinguish between the two types of plastic surgery that we perform. Because yes, the breasts were mostly for aesthetic reasons, and the nose was entirely for functional reasons.
Yeah, there's a huge dichotomy between
absolutely
the two for me.
Have either of those, have you noticed one affecting your life more than the other, based on that distinction?
The nose has been the biggest relief that I've gotten. Again, I mean, breathing's so important, but the augmentation as far as confidence has been a huge part too. And I won't discount that there's also been a negative aspect of like some unwanted attention that also comes into play with that. But it all comes down to how you deal with it. And if you give it fuel, it will become a fire. And if you don't, it doesn't. It doesn't affect you. And so I try just to ignore it and kind of push it to the side and say, okay, like, I appreciate it, thanks, but no thanks.
I guess I do have one more question, actually, now that I think about it. What advice would you give to anybody considering a breast augmentation or a lift or a septoplasty?
Do your homework first, because what people will tell you, their experience, and what your doctor is going to tell you might be two different things, because their experience could have been 5, 10, 15 years ago, especially with a septoplasty.
Sure.
My mom was, because she's had a nose job as well. She's had 2, and I was a little bit concerned about the packing and everything like that, because it used to be the cotton, you got giant cotton balls stuck up your nose, and that was not how it was at all. Now they're kind of like plastic tubes, and you can actually breathe for the week that you're healing. And so that was a big thing for me, is that other people's experience and what you're actually going to go through is going to be different. Everyone's unique in that way. So just do your research and listen to what your doctor says. Also listen to what your gut says.
Sure.
Because your gut is going to tell you who to go with, or what size to do, or whether you want high, them to be higher, or if you want the lift, or if you want like high profile, I think is a thing too. There was one thing that a couple different surgeons told me. It was, well, go bigger because you'll always regret not. And I think I took that a little into my own decision.
Yeah.
And now I regret that part.
Yeah.
It was something that if I would have stuck to my guns, I would have probably been 100% happy with.
Interesting. Because I think a lot of that, there's 2 reasons that comes about, I think. This is my opinion. The biggest complaint from breast augmentation patients is, I wish I would have gone bigger, 1,000%. And so a lot of surgeons tell that to their patients. I tell that to my patients. And I think a lot of times that gets heard as, you should go bigger. Number 2, though, is I think that there are a lot of surgeons that impose their idea of beauty on their patients. And I've seen in practice a lot of surgeons who all their patients get 500 cc plus implants because that's the way that's what they think looks good.
Yeah.
And I think an important part of plastic surgery is allowing you've got to work with your patient. They need you to guide them, but you've also got to allow them to pick what is best for them and tell you exactly what they want.
Yeah, it's important to have, a good balance between the two, for sure. And I agree with what you said, that when doctors tell you that you might regret not going bigger because you get so used to that kind of puffed up look when you're swollen, that it definitely does get heard as you should go bigger.
1,000%.
So, it could be just a turn of a phrase that everyone kind of needs to look at as being a little bit more of a suggestion, rather than like, you absolutely should pump those puppies up.
Thank you for coming on today.
Well, thanks for having me.
You're awesome.
Oh, you too.
Um,
I'm glad we got to sit and chat.
Absolutely. This is Haley DeBruin again, guys. I don't know if do you have anything that you want to promote or push or say, go see Blood Moon Majesty anytime.
Come see us. We have a couple shows in October. We're on Instagram and all of that jazz. It's funny. What we've recorded was one of two things. What we recorded was pre-septoplasty and two, me finding my right vocal range, because I came into it as a singer after our now drummer was a singer. So everything was written in his range. So all of our older material that we recorded that were original songs were written a half a step lower, and all the stuff we're going to be recording that's new is all written in the right range. So it's kind of interesting with that. So you'll see kind of a difference if you come and see us. You'll definitely see a marked pre and post septoplasty, but we'll be re-recording everything. But yeah, check us out, Blood Moon Majesty on Instagram and Facebook. And we've got 2 gigs in the end of October, one at Ice House. I think that's October 21st, and then one up in Ogden. I think it's the Funk and Dive Bar in Ogden. So Halloween shows, which are going to be awesome.
Both good places. Also a good band and a great person. Thanks, Haley.
Thank you.
Thanks for listening to the Naked Patient Podcast. Stay tuned for the next episode. Till next time.